Last week in Healthline, I told you about a new study that shows the best way to stop a stroke before it happens, and that it may depend a lot on your age. In older patients, it showed surgery to clean out clogged arteries and restore blood flow to the brain may be better. Again, that's for seniors. Now, while tiny wire scaffolds or stents that prop open clogged arteries in the brain may be best for younger people. Dr. Albert Sam is a Baton Rouge vascular surgeon who does both procedures and was one of the main researchers in that nationwide study. He says there are reasons surgery can be a better option for potential stroke patients over the age of 70 when compared to a less invasive stenting procedure.
In order to do the stent procedure, you pretty much need a straight shot from the heart to the neck. As you age, those vessels become a little more elongated, so it's less likely to have a straight shot from the heart to the neck.
Now, there are even more reasons surgery may be the best option for seniors at risk for stroke, but before you jump to any conclusions, be sure to watch Healthline tonight at 10 o'clock. You'll find out why Dr. Sam says there are times when older people may do better with stents than younger people, and
a Baton Rouge doctor is raising new questions about a study done right here in the capital city.
Phil Rainier explains in tonight's 9 Healthline report.
Blockages in the carotid artery that pumps blood to the brain made 76-year-old Gerald Goodwin a prime candidate for a stroke. He was willing to do almost anything to avoid it.
I know a few people that had stroke. My mother had a few strokes.
Goodwin had surgery. Look closely and you can see the scar on his neck. It cleared out a lesion or buildup of material inside the artery that threatened to cut off blood flow to the brain and cause a stroke. Dr. Albert Sam is a vascular surgeon in Baton Rouge. He was one of the principal researchers in a nationwide study widely publicized to show surgery is the best way to stop strokes before they happen in older patients. But Dr. Sam says the study also suggested there are exceptions to every rule.
But every person has to be treated as an individual. I've seen 80-year-old octogenarians with body types and lesion characteristics better than that of a 50-year-old. And we've done stents on them and they've done fine.
Which under the right circumstances could make someone at Goodwin's age a good candidate for a less invasive stent and send someone younger to the operating room. Unlike surgery that removes potential blockages, a wire stent restores blood flow to the brain by literally propping open neck arteries.
There's a lot of nuance here.
Dr. Sam says the important thing is not to assume one stroke-preventing procedure is better for one person or another just because of age. With Healthline, Phil Rainier, WAFB 9 News.